Thank you, David. Thank you for inviting me. I'm really sort of proud to kind of present what we've been doing with openOutcomes. So openOutcomes is an open air-based native patient-reported outcome measure and patient-reported experience platform. We've been developing it for a number of years now. I just thought this slide up here, where I see most businesses outside of healthcare spend quite a reasonable amount of their kind of cash on quality control. But if you look at healthcare, they probably spend less than 1% actually looking at what their customers want, i.e. the patients. So we don't often ask in a structured way what patients want. Okay, so we don't collect those PROMs routinely. So how do we know that what we're providing in their care is actually helping them? So that's a really critical point to highlight. So PROMs are basically set questionnaires that patients get asked. They're sort of validated from research, and they sort of ask questions sort of based on the patient's symptoms. Okay, so they're very specific and they're validated and they can't be changed basically. So what's the reasons of collecting PROMs? So there's been many reasons. So there's been lots of policies. So going back to the Darcy report in the NHS 2008 said that we should be looking at high quality care for all. So we need to collect PROMs. Again, there's a 2010 report in equity in healthcare. Again, says we must be collecting PROMs. And more recently, the Cumberledge report has suggested that we should also be collecting PROMs, but we don't do that routinely, so we need to be able to do that, okay, to look at the outcomes from patients. So how should we do this? So, I mean, the best way really is to collect it once and use it for different uses. So you can use it for individual patient management, you can use it for service improvement, research, registries, auditing, benchmarking. The key thing is you're going to have to use it in some form of computable format that can be reused, okay, rather than collecting multiple questionnaires in various different formats, whether it's paper or electronic or registries. So I thought I'd just use a clinical example. So this is quite a obviously gruesome picture, but this is the front of your knee when you open it up, just before you have your knee replacement. There's this sort of big, where the arrow is, a big fat pad, which we remove because we want to get access to do the knee replacement, okay? And that was routinely done, we all did it in training, people in it, knee surgeons did it. But actually, we found out, actually, is that the right thing to do? Does that affect the outcome of the knee? Is it less painful, more painful? Okay, yes, it helps to visualize what you're doing, but actually there are other important aspects such as the blood supply and the biomechanics, etc. So we looked at the Oxford knee scores and said, okay, well, what's the difference between excised or preserved, okay? And there was a difference, yeah? So, in order to do that, we did the PROMs, okay? So we don't know, and you can see that the PROMs of those who left them in actually was better than the ones that took them out, okay? And you can see that it's actually the differences around the pain and pain at night, which was the main thing. So really, you would, if you didn't collect your PROMs routinely, you wouldn't know that, and you're like, well, as a surgeon, I would like to know that because then I would now change my practice. Okay, so we need to use evidence-based medicine, but using real-world data. We can't all do randomised controlled trials; they're very expensive. You can't do it. No one will fund that. But this is very easy. We just need to set that up. But we know there's big challenges, don't we? I won't go into detail. In clinical, various PROMs are collected. They're collecting all sorts of stuff, mainly on paper. Health systems don't routinely collect it, and if they do, again, it's in paper. They don't have sort of specific systems to collect it in. And then obviously, digital developers create their own silos of data, isn't it? And we put it in registries. We never see it. We see a report at the end of the year. What good is that? I want to know now, real time. So I can correct things. So we looked at the market and we said, look, all these other commercial suppliers, they don't really do what we want. So how do we build it up from the ground up? And we created a collaborative, formed under the Aperta Foundation. We chose more of an open source standard way of trying to do this, because silos are not working. So this is a group, we've got quite a diverse group. I mean, we're sort of mainly orthopaedic led, but you know, it's something that could be for any pathway, such as cancer, cardiology, etc. So this is sort of a kind of overview. You've probably seen this slide before, but really it's about separating the data from the data layer from the application layer, and then obviously you have that messaging systems and in between. You get the openEHR APIs, etc. Okay, so what we want to do is create a world-class PROMs and PREMs solution for the NHS. Okay, built by NHS people, right? We want to be able to look at the population level analysis, look at costs, look at various aspects of their care. Okay, and you can do that through structured data. Okay, so we asked the clinicians, we asked patients, what should we do? And that's the right thing to do, and then built up from there. So this is just summarising the issues. So fragmentation, who owns the data? Yeah, that's fine. They're data sort of controllers. Vendor lock-in is I think the biggest issue at the moment. And that will affect data sharing primarily. It's not necessarily the technology now. It's the commercial kind of lock-in element. And then there's other issues like technology bias, vendor sort of insolvencies and various things. So we did this, as we say, we worked with clinicians, obviously with myself and others, and we built it from the ground up, and we chose openEHR because it made sense. It's it's a clinician-driven element to it. I could sort of put what I wanted in there as my data model because I knew about my specialty, And I've always thought if everyone knew about that and they could build their own models and then get reviewed by various people in different national societies and say come up with this maximal data model, you can then scale that up and then reuse that data model for everything. So again, this is again an overview of how openOutcomes is set up. There's a sort of client level, sort of middleware. We've got the openEHR CDR, which is on Airbase, so the Airbase open source CDR, and obviously that sits underneath is that Postgres sort of database, relational database.
Where do you host that?
So that's on AWS. Yeah, so that's our implementation in Northumbria, isn't it? Yeah, so and it will be in our trust as well. So yeah, so this is we built it. Looks at patient based on pathways, so things like sort of hip knee replacement, shoulder pathways, all the different things where clinicians in their subspecialties will follow that patient in a longitudinal way from the point at which they were seen in a clinic, post-procedure, etc. And also during the procedures, we have collect procedure details as well. And then we've got PROMs that sort of follow along that line in certain time points, which is, if you like, customizable for each hospital. Okay, so again, sort of some screenshots here of this. I'll go through a quick demo. I've got time for that. So I'll just rush through there. So we do integrate with the PAS. We can also integrate through HL75 for messaging, and we use Elasticstack for some of the data visualizations. So patients get images or their packs, the PROM sent by email and SMS, and they can respond either remotely or in clinic, so they can do it on your desktop or on their own devices. So this is a bit more of a kind of detailed kind of architecture of specifically of our setup there. Yeah, so this is the patient app. I'll run through a quick video actually of this, sort of how it works. We tried to make it sort of using the NHS sort of colours and kind of UI sort of design, and so the patients can actually open the app, sort of confirm their date of birth, their name, okay, and then they can fill it in straight on their phone or via an email. So we also have a paper option as well, because we know that not everyone has devices, and some people may not have access to an internet or something like that. So so we have a clinician portal, and I'll quickly go through that and show you a bit more of that. So and obviously we've got a reporting kind of platform that's based on Elasticstack, where you can look at population level data as well, which is really useful for audit and research. And that's where you found those insights with that sort of fat pad thing from the knee, that you wouldn't have identified as an issue, but you probably knew that the patient weren't particularly happy with their knee replacement. So these things are really, really useful in a clinical setting. So I'll just quick do a demonstration here. So this is, I'd log into, this is a clinician portal, so it would have all my patients and kind of what how many problems were due and what the response rates are. This is a demo, so you see it's not live implementation here, and then it's obviously linked. So if I can go search the patient, so this will be linked to the PAS, and then we'll go to the patient that we click on. So here they're on what they call a soft tissue knee pathway, and you can look at the details. So you can look within their pathway. You've got their preoperative PROMs, so if you use an EQ5D and this Q score. They've had their soft tissue knee procedure, and then they've had their 6-month score as well. They've done most of the scores, but one of them hasn't been filled in. It's not green yet. So again, it's sort of that can be identified as we could get someone to chase the patient out and say, would you mind filling this in, so you can increase the completion rate, because that is a big issue with PROMs, is that patients don't fill it in, and it's how do you capture that information? Well, if you don't have an electronic system that doesn't flag up that, you can't then chase them up for it. So that's one of the important things. And then here you can go into the procedure details. So for this was soft tissue knee, it's quite detailed, so it's got all the things that the specialists in the knee would want to kind of look at. Got their kind of procedure names, so you've got a whole list of their SNOMED codes, and then you've got all these sort of findings and other bits and pieces which I won't bore you with. But it's very easy for me to now just quickly whip through this after I've done the operation and go, wow, that I don't know, no free texting here, no oh yeah, I remember that now. Oh yeah, I did do that. So it's an aid memoir as well, because we do forget things. So and I think it adds an extra layer of sort of reminder to the surgeon, because we're all busy, aren't we? And we're all doing things. So it's easy to miss these things. But if you've got a reminder here of all the key aspects, and you can write these up, and you've got your post-op instructions, and then what we would do is obviously we could print that out, and it come up there. So, well, if we had like a Cerner application or kind of Epic, that would be sent as a code 64, a coded PDF into Cerner. So then it's within the patient record that everyone has access to. But obviously this will sit within the openEHR CDR. So you can look at outcomes now for that particular patient over time. So you can say, well, they've had that procedure sort of number 1. And you can look at the sort of individual outcomes for their individual scores here, and you can see they've had an improvement over time. So we don't need to worry too much. And if you wanted to then break down those scores, find out what specific aspects of that PROM they've answered, you can. It sort of breaks it down sort of fairly nicely there. And you've got this. Yeah, so it's a good way of visualising. It's something you can actually show the patient as well. Say, look, this is how you've improved. You've done really well. This is kind of what we'd expect, or or better. So it's a nice way of communicating to the patient. Patients will understand that it's graphed and their raw score 54. What does that mean? I don't know.
Yeah.
So that's kind of the overview there. So if we go to patient experience one here. I don't know where we are. So this is kind of way, sort of how the patient might sort of get it on their phone and how they fill it in.
Welcome to the openOutcomes patient experience video.
In this video, we'll be exploring how a patient is set up to receive PROMs in openOutcomes and how this looks when the patient completes the PROMs themselves. PROMs capture the patient's perspective of their condition for which they are being treated. It helps monitor outcomes over time and after interventions. First, we must find the patient by clicking on the Patients tab on the left-hand menu. openOutcomes can link to an existing PAS, and patient's information can automatically be pulled into the system. Alternatively, it is possible to create a patient locally within openOutcomes itself. Here, I will quickly create Joe Blogs and save their details.
So you've got contacts, so which you can choose whether they want email.
You can search for a patient by their NHS number, hospital number, or their name. Here, I'll search for the patient to review their account. The patient overview screen shows which PROMs are due to be completed by the patient based upon the care pathway that they're on. Here we can see the patient is on a shoulder non-arthroplasty care pathway, and they will be sent a collection of relevant PROMs automatically by openOutcomes at 3 months, 6 months and 12 months following surgery. Clicking on the Edit button shows the details that can be amended for the patient. Importantly, without an email or SMS contact being approved, openOutcomes will only allow a paper-based PROM to be printed and sent to the patient. Those PROMs that are printed and sent to patients via post can subsequently be input by a user into openOutcomes on the patient's behalf. This avoids digital exclusion and digital inequality of care. As we have seen before, the patient has previously been sent a shoulder non-arthroplasty PROM to complete. It is possible to send another set of PROMs to the patient using the Add Pathway button above. But first, let's take a look at what the patient has received. Here we can see the patient has received and opened an email or text, and their phone browser is showing a login screen. The login intentionally avoids the patient needing to create an account and instead relies on them verifying their personal details. Putting in the correct information that corresponds with the details found in the system, the patient will continue to the PROMs questionnaire relevant to their pathway. Typically, the PROMs questions are digital equivalents of paper-based versions. Questions are presented to the patient in easy-to-read and complete sections. Where required, the patient will receive instructions to provide guidance on how to complete the questions, or to provide details of why these questions are being asked. Once the patient has completed the PROMs questionnaire and submitted their answers, we can see the completed PROMs in openOutcomes. As noted earlier, patients will receive further PROMs questionnaires at set intervals throughout their care pathway. And of course, openOutcomes will automatically send reminders to patients who have not yet completed their PROMs, though a user can manually send reminders also. The next step is for one of the clinical team to review the PROMs either to support clinical decision making or as part of a wider research project.
So yeah, so that's a sort of nice way to see how the patient may interact. So I talked about the population level statistics. This screen, you can go to the report section at soft tissue knee. It's about what 1,500 soft tissue knee patients who've had. I see the drop down with all these different procedures here. So here you can actually then break down the scores. So for example, you can look at, so if they're a current smoker. So what we see here, there's that line that drops down. So this is the baseline, which is that pink line, and you see this green line is actually saying smokers don't do so well, which is actually really powerful. And you know, you could then also show patients and go, look, If you smoke, you're not going to do so well as if you didn't smoke. So this sort of information is really, really good, and it's sort of useful for us clinicians, for patients, for the hospital management, you know, looking at various aspects, you know, and this is all kind of live data that you can see straight away. So that's it.
Thanks very much, Kanthan.
A few minutes for questions.
Yeah, a few minutes for questions.
Hi.
Yeah.
How you solve the license problem?
Yeah, so we work very closely with the Oxford Innovation Groups. A lot of the scores we're using is from the Oxford Group. And we have an agreement with them that they're happy to use it for NHS or not-for-profit organisations for free. So the only thing that they would want is a screenshot of your kind of questionnaire, and they review that and they say yes or no. You know, does it represent the correct questions and answers, you know, and things. And that's all they want. And apart from that, you don't. But if you go to a private organisation, profit organisation, they'd have to have a separate licence, which they can sort of get separately outside of the openOutcomes sort of, if you like, platform.
Yeah, I saw you have this 5Q whatever.
EQ5D, yeah.
Yeah. I know they have been turned down our request to make archetypes out
Yes.
of it, but
Yes.
you managed.
Yeah, because remember, the archetype is not what's being represented here, it's the UI.
Right.
So the archetype, it's that representation of the archetype, isn't it, that they want to see, not the kind of data structure behind it. And also, it's the EQ5D. As long as you've got a license for the which is free for the NHS,
Right.
then it doesn't matter. They used to do the review screenshots. They did ask for that, but they don't ask for it anymore. So long as you put in, as we've been doing, you put in the archetype that you can only use it under the copyright, and you put the link to the copyright, then you're covered, because you're not using it outside of the copyright. You've told the user of that archetype, in order to use this in production, you need to get the license to use it.
So that means that the UK has a national license.
Effectively, yes, but each individual, like typically NHS is made up of millions of different organisations, but they all have to ask for it, but they get it for free. Yeah, but yeah, it would be simple if they just had one, wouldn't it?
Yeah.
It's worth noting that it helps that the template, the archetype and templates contain, in our version, all of the text, all the localised text for EQ5D, and that's the one thing that is possible for them to quite easily review. So it has everything that's necessary to prove that you're going to correctly display the
The archetypes, are they published on the apprentice again? Or
Yes, yeah.
do you have any thoughts about putting them into the international?
Yeah, so this is the discussion we're having at the moment, because I sit on the openEHR clinical program board, and because PROMs is very unique, we haven't quite kind of agreed the kind of 100% of how that kind of framework of modelling PROMs is yet. So it's a good question. You know, ultimately everyone's doing it slightly different. To be honest, you know, I guess, you know, like ourselves and Better and whoever doing PROMs, it's all going to be slightly different. But yeah, we need to conform to that. But that's a work in progress.
And once again, it's notable that our opinionated version is very much that everything's within the OPTs, including all your localisations, which means that all of the screens that are shown for patient demos, they're all dynamically generated from the OPTs. I mean, there's actually a UI template in between, but the UI template is dynamically generated from the OPT and then reviewed and then used. So source of truth is all the OPT.
So that's where I think the pattern, that's my personal view, is probably where I think has to go, because it's so strict that the PROMs licenses won't allow you to use the PROMs if you just change a dot or you know, you don't put something in bold that was originally in bold, or you change the wording very slightly. They won't allow you to do it. So it's such a fixed thing that we can do what we're doing, it's much easier because you're just taking that
Yeah.
as is, not getting someone else to do all the other different works. Otherwise, you have to then get them to re-review it, do the screen review, etc. So yeah.
And that's taken a lot of interaction, as we said, with Oxford and with
Yes.
CQ.
Can imagine. Yeah. Adrian, last one.
Yeah, and so I've done some work on PROMs myself actually. We have personal health record in Southampton, so I like what you've done here. It's good work, so well done. On the BI side as well, pretty impressive, I think. I was wondering, do you not worry about sending out text messages to patients and getting them to follow links these days? That seems to me really highly risky.
Do you not know that that's kind of what all these patient experience portals they've spent loads of money on doing and
Not ours,
everything?
but
well, exactly. I mean, I don't know. That's what the normal practice is now.
We've got to be getting away from that, though, haven't we? Surely.
Yeah. I don't know what the solution is from a security
NHS
perspective.
login is the obvious
Yeah.
solution to it.
Yes, yeah. We certainly are having apps that are using that from a clinician and healthcare workers logging in via NHS app, two-factor authentication. But then we return to the back to the issue around, will the patient go through multiple steps just to answer a questionnaire? They'll probably just go, oh, sorry, I'm not doing it.
Yeah.
So you're going to reduce the friction, but keep it safe. And it's a real difficult balance, isn't it?
Of course, but there are well-known scams associated.
Of
with
course,
text
yeah, no,
messages.
exactly. You don't know, just click on it and that's it. You just, I don't know the answer.
No, but yeah, it's reducing friction. That's the big thing. It's an issue if you make them go through any sort
Try
of...
using that in court.
I mean, they're only receiving the emails and the texts in the same way that they would from the hospital through the existing.
I mean, there is a level of authentication, isn't there? You have to put your date of birth and name.
Oh, I'm not so worried about
just,
that. I'm more worried about people spoofing your site to obtain
So we've gone all through the pen testing and cyber security. I mean, obviously I'm not an expert on this, but I know cyber security is an issue, and I think any bad actor is going to be able to do anything to any system. Yeah, but I don't know the answer. I think that's the cyber security thing is a thing that I don't think the government really have had a solution on how we protect our services. We've been attacked a number of times, but it's such a big issue.
The risk here isn't so much around attack, it's around spoofing.
Yeah.
But I think the thing is, so we're sending all the emails and texts that come out are going through the hospital system that they're using for their message.
I know it goes
yeah. But you're saying that's not right. That's not right. You're saying that's not right, are you?
Yeah.
So that's right.
It is sort of interesting. It's a preoccupation in the NHS, this particular issue, but in other health economies we work in, there are slightly different solutions to it. So we might park that one.
Yes.
I saw there was one more question there, so I'm just going to.
Sorry if I missed this.
Okay.
Is this currently integrated in your standard practice?
So it will be. It's going through Virgin IP address, all these issues first, and then we're getting in. But it's live in Northumbria, so one of the big NHS organisations. It's up and running, and it's live. It's doing stuff. So.
But this is only for PROMs.
Yeah. So it's PROM.
So is not integrated with all the other clinical.
Well, there is. So we have Cerner. So I mentioned there, sort of what most integrations are now, in at least in the NHS, is a base 64 coded PDF that gets dumped in the whole list of stuff that you've got. So that's what our integration. We can do that. So once the patient completes the PROM, it gets sent onto the system the general system that someone has viewed. It's obviously in a non-structured way, PDF, etc. But yeah.
Great. Well, thanks very much, Kanthan.